Good morning. I'm Dr. Alicia, medical doctor and epidemiologist, technical director of Nouna Health Research Center at the National Institute of Public Health in Burkina Faso. I'm happy to be part of this panel to present on climate and health evaluation and response system, CHES, data system for climate change impact monitoring. Climate change is about to be the most important health challenge of human history, particularly in sub-Saharan Africa, increasing disease burden with a wide variety of severe physical and mental climate-sensitive diseases. Low and middle-income countries, they need health data. They need health data to value and to quantify their burden of disease due to climate change in order to mobilize financial resources from the Climate Adaptation Fund. And for doing that, they need longitudinal population-based data that is key to analyze and find out who will be affected and to how much, and also to assess and monitor the effectiveness of the different interventions that are in place to protect population against the adverse effect of climate change. So several data sources exist, and I would like to flag here two. One is the Routine Health Management Information System, HMIS data, that is available on DIH2, District Health Information System. And this data is widely used coming from the health facilities, but the issue that, as we all know, is the poor quality of the data and the non-exhaustivity. Since it's mostly collected from the health facility, we are more likely to capture those who are attending the health facility. And the second one is the Health and Demographic Surveillance System, HDSS, which you can see here in the right side for those who are not familiar. It's a population cohort established in a defined area, a geographical area, started by a baseline census, and the census allow you to have a population cohort that is followed out over time and collecting a vital event, birth, death, in and out migration, and performing verbal autopsy on all the deaths to try to ascertain the cause of death. This appears to be a good data system, but still the weakness is that it's mostly focused on mortality, and the morbidity data is really partial. That will not allow you to really capture the epidemiological transition. So CHES data system appear here to be a good compromise, bridging the gap between the HMIS and the HDSS to put in the same place morbidity, mortality, climate data to allow you really to build a right burden of disease estimate. Here I would like to present an example of the HDSS data. This came from Nouna HDSS, where we wanted to look at the effect of temperature and rainfall on the mortality. On the left side, you can see the graph with the U function showing the effects of temperature on elderly, meaning that low temperature and high temperature both has impact of increase of mortality on elderly. The right side, there is a figure showing the rainfall effect, the monthly rainfall effect on mortality, that show that a threshold of 100 millimeter monthly increase the mortality, up to 7 times. It's a linear increase. So what is CHAIR's objective? CHAIR's wanted to really leverage the HDSS system to HDSS to make it climate research ready. And for that, we will continue assessing the population dynamic. We'll improve the morbidity data collection, the data system, and this will allow us really to establish the right population burden of disease, which is a composite of year of life lost due to premature death plus the year of life lived with disease, knowing that the year of life lived with disease has a major contribution to the burden of disease, and this is coming mostly from the morbidity data. So how do we get there to have such a nice system? We will first continue with mortality data collection while focusing more and more on morbidity. And morbidity, we will do it in a comprehensive manner, avoiding seasonal bias, and by doing a weekly sampling so that we'll have the morbidity data all over the year. We'll collect both acute and chronic illnesses, the nature of the illness, and we'll collect up to 13 symptoms, the duration and the severity of the illness, and the handicap. These will be done through interview, but on top of that, we'll add anthropometric measurement, vital sign collection through wearable devices that people will wear, and will collect also some biological sample for lab testing. The meteorological data will come from the automated meteorological station that are installed on site, and we use validated algorithm to assign the cause of death and the ICD-11 to code for all illness episodes. So here is the overall data system of CHAIR's. We have 3 main parts. The first pillar is the data generation and collection. The second one is the data management, and the third one is the data access and visualization. For the data generation and collection, we have several data collect points. The first is the population cohort, where we'll collect vital event. The second one is the climate and environment data collected through automated weather station, and we also collect satellite-based remote sensing data. The third is the habitat, where we collect indoor temperature and humidity, and for the individual level we'll collect vital sign using wearable devices. So for the data management, let's say that from the population cohort, habitat, and individual data will be collected using the field workers. It is electronic data collection, and the data will be uploaded on a cloud server. Climate and environment data also uploaded to the cloud server so that we have all the data in one place, and we generate graph-based data for the CHAIR's database, and data is accessible through the web or through the CHAIR's data server. In conclusion, I would like to say that adaptation to climate change impact require good quality data, longitudinal population-based data, and a comprehensive morbidity, mortality, and risk factors data. And this data will help to claim for compensation that remain the battle cry of lower income countries. And CHAIR's data system appear here to be really a good vehicle that will really lead to this achievement. And that I would like to really thank you for listening.